use the arrows on there.
Okay. I'm Veronica Moody, Regional Emergency Preparedness Planner at the Tri-County Health Department. My background is I'm a retired United States Air Force public health technician. Hoorah. So from 1984 to 2006, I was in the Air Force as a public health technician. In the Air Force, we do a little bit of everything, but not really experts on anything. So we're similar to local health departments. So I have that background. Also, after that, after I retired, I became a MEM at Buckley Air Force Base. So my sole job there, sorry, I didn't get any water. My sole job there was to reach out to the community, harass the local health departments to make sure that they were keeping in contact with Buckley Air Force Base. We did have some contact with the VA that's there, but it was in a different jurisdiction. Thank you. And from there, I went to the Office of Health Affairs at DHS and helped out with their CBRN exercise planning. And then I begged to come back to Colorado because I couldn't stand being in DC anymore. And the people that I used to work with as the men at Buckley were actually hiring at the Tri-County Health Department, so that's how I ended up in the local health department. So I touched on a little bit of everything. So, just to give you a perspective of what we're looking at in Tri-County, the three counties that are listed there, Adams, Arapahoe, and Douglas, are the Tri-County region. The star represents Buckley Air Force Base, which is in the city of Aurora, West Aurora, and the 4 stars at the bottom in El Paso County, but 4 other military bases that are about an hour away from us. The El Paso County Health Department is not very large, so we do often support them in any of their events, such as the Black Forest Fire that just happened in that county. Elbert County, all rural, they have 1.5 FTEs, so we also help them also. We can't change our name to Quad County. So we still continue to be Tri-County and support Elbert. As you can see, Denver is right smack in the middle. That blank area up the top is actually the Denver airport, which is technically in our county, but it's the city of Denver in that area only. So luckily, we do not have to deal with any of that. We consider Boulder on down to Douglas, Jefferson, Gilpin, and Clear Creek. Everything that's highlighted to the right is called the NCR. Our NCR is the North Central region. All of those entities, jurisdictions, we work together well. There's 26 hospitals. Everybody has their own health department. In just our 3 counties, we have 1.3 million people that we take care of. It. Most of the people are in that Denver or our metro area. Everything else is rural. Buckley Air Force Base, like I said, is in the city of Aurora. So the city of Aurora, all 3 counties have an Office of Emergency Management, which we work with closely. Plus, the city of Aurora has their own Office of Emergency Management. Plus, Buckley Air Force Base has its Office of Emergency Management. So we have to work with all of them because we actually fill the role of the SF-8 in every one of those EOCs. And when I say we, I mean our office, which has 5 people. So we work with Buckley. We've actually got a signed MOU with them. We have a couple of other things. But let me back up. We have a Type 3 incident management team, a public health incident management team that we run within our health department. Does anyone else have one of those that they're using during any incident? So our intent is to get our whole department into the ICS NIMS mode through any type of emergency that happens. So for instance, the El Paso fires just happened. We just had a water break in another city of Brighton. Even when there were shooting, we were activated as a IMT team first to see if we needed to elevate our response to an ESF level. And we try to do that as often as we can so we can support anything that happens, not just SMS, sorry. Okay, so ESF 8, we moved from the FIP to the ESF 8 And we also try to make sure that we respond to everything. So keep that in mind. We'll get to that later, show you how that's important when we actually show up to the table with Buckley. So we have an ongoing partnership with Buckley Air Force Base that was started by me when I was in that position as the contractor person there. They didn't really have anybody that they knew of that was on the base, so it was a 4-year contract that the Air Force had put in place to have these people do these specific things. From that assignment, we got invited to the Tri-County Health Department's Healthcare Coalition. This was back in 2006. So that organization has been going on since then. We've participated in the North Central Region and jurisdictional exercises, which are just Tri-County related. We've invited them to the Regional Access and Functional Needs Committee. We've had ongoing communication with public health because they take care of the disease investigation for their military personnel. So that was their one in, but like you already know that person keeps rotating every 2 years. And then we also invited them to the Regional Emergency Managers Forum. So we're looking at all these different forums for everybody to participate in, and it's not just the medical people that we're reaching out to. So some of the challenges, which Pam has already said, the frequent changing of military staff, that's very frustrating. It helps when you have men that are civilian personnel. It helps that the emergency managers are typically civilian personnel, the actual emergency manager for the base, not the medical emergency manager. So our challenges as ESFA is confusion on how we play a role and how we support Buckley as ESFA. We would think that the medical people would happily fill that role on the base, but they kind of shy away from it. They really don't understand it or how to staff it or fill it. So we offer to do that for them. We're training to fill that role for themselves. And confusion on who to contact for assistance. So if they have something going on the base and they think they can take care of everything on the base, and they often find that they can't, who do they contact as the SFA outside? Do they go to the city of Aurora? Do they go directly to us? Do they just stumble around on the base and call the bases that are an hour away? So that's one of the challenges that we're having with them right now. You wouldn't believe how many, I think the hospitals in our area are convinced that there's a section of the Pentagon that just calls, prank calls after an incident, because after the shooting, that's all they got was military people saying, I'm calling for General such and such. The hospital's not intimidated by that. They don't know who General such and such is. They really don't need those calls at that time. So that was one of the challenges and issues we had during that response. We continue to show how ESFA can support anything that Buckley can do. I think we talked about different silos. That was a big problem. The emergency manager did not recognize anything that the medical person would do on the base because they had such a relationship with their the EMS, the ambulance crews that showed up and fired. So they were completely discounting the medical people that were on the base. So we're trying to help them with that by showing up and asking the questions as the local FIMT, the incident management specialist, and the ESFA. So how we do that is within our office, we fill each role. Our director can be the incident commander on the INT. I fill the logistics role. We have a liaison role. We have a person that does planning. We have a PIO that we can bring with us, and for the ops section, we use a nurse or an environmental health technician or a environmental health nurse, and there's another section, disease DIS staff. They can be the ops people. What we can do is take that whole team of us and ask for a meeting with the light people on Buckley Air Force Base and have them, not just FIO, not just the MEM, but have everybody that's accountable for emergency response in the room and have those specialists ask those follow-up questions, like someone else was saying earlier. You take the next step, how do you drill down, and make sure that those plans are working for them and supporting what we're trying to do. some of the successes that we've had. We do have a signed MOU for Buckley to receive S&S from us. They do have a cache. Most active duty Air Force bases do have a cache available, but like I said, it's for specific instances. They realized that and they requested whatever else they need to supplement that cache. They want to be able to take care of everybody that's on the base at the time. They have active duty, Guard, Marines, civilians. They have people that work behind the fence. I still don't know what they do. There's a big giant golf balls there. But they have medical people back there that take care of that stuff. That's what they look like. We have an MRS MOU, a regional MOU. It doesn't say much. It doesn't bind into anything, but at least it's signed. It's signed by every city manager or mayor, every public health agency, and every hospital in the North Central region, plus the VA, plus Buckley. And they put in some of the language that was discussed earlier, the legal stuff saying you can do this for this amount of time. After that, you pretty much, we can't help you. It does specify the things that they want the MOU to cover is evacuation, medical surge, sharing of supplies and things like that. So we have that. They've also been a healthcare coalition member since 2007, and we have everybody at our health coalition. We have all our emergency managers, law enforcement, all the hospitals, the public health staff that's on our fence, and Red Cross, all different kinds of people. We meet quarterly to discuss different issues that affect our planning for the area. So right now the big thing is evacuation of special needs places. So we're keeping Buckley in the loop for that also. So let's learn, again, be patient. There's a lengthy process to get agreement signed. What I did after being in the military, I know how things get lost. So I would print like 5 copies and have the commander sign all 5 copies. And I'd send it to the legal office. And then a week later, I'd show up at the legal office. And they'd say, oh, we don't know what you're talking about. Well, here. So there's my second signed copy. I take it with me all the time. You just have to be annoying. And finally, we got it signed. A lot of times they didn't know what they were signing, so we had to be prepared to explain it in layman's terms of what the benefit of signing the MOU was for. Know who to contact to get results. I love the public health emergency officer. I worked in public health. We worked hand in hand with like that. Most likely, it's great to meet that person. It's great to meet the commander, but most likely that's not the person that's doing the planning. They're just the face. There's a person, you need to ask that follow-up question. Great to meet you. Who do I talk to that's actually writing this plan? To have them come to the daily meetings, to have them come to the other healthcare coalitions so they know what's going on. And they're going to report everything back to that DO so he can get that information to who he needs to. It's just the right thing. Don't be dissuaded if you're talking to the commander and they make you work with someone with just 4 strikes. A lot of times that person is the actual person that you want to work with because they actually know what's going on and have been doing it for a long time. I'm just saying that was me. Are you user friendly? I know they've been saying a lot of people, you should be contacting the health department. So check out your website, because I have to do this old school. When I say old school, that means 2006 and before. They drilled into us. When you go on your base, call your local health department. Look in your phone book to see how when I just moved to your city, can I easily find somebody in your local health department to talk to? I've run the gamut. I've been to places where they have said, oh yeah, hey, how are you? And I've never heard from them again. And they dodge our calls. I've gone to places where people wanted to recruit us immediately to help them do everything. So you run the gamut of that. So just make sure that you're easily findable. Maybe a military liaison link on your website might help. I don't know. Something that would help me a lot. And the same thing, when you're trying to reach them, if you're at an Air Force base, I need you specific people to ask for. So of course, we're talking about the public health emergency officer already, flight doc. He still has to see patients, he still has to get flight hours in, he doesn't have a lot of time, but he's good to know. The public health officer plus the technicians, pharmacists, you should have them at the table also. They do have a lot of planning experience, especially for pills. Sometimes they have equipment that they can use, negotiating barter to use. They do have volunteers that work in the pharmacy, so they can help you if you're starting an MRC to help you figure out those kind of aspects of gaining volunteers. Medical logistics. These guys are the experts in warehousing and supply chain. I actually consult with them to help me with my local transfer points in our agencies. The emergency manager base, the medical readiness section, which is where the men will be. There's a bioenvironmental engineer, which is equivalent to your environmental health people. They have cool toys. So just if you just do anything, just ask them to show you their stuff. They get really excited about that. Exceptional family member program, school liaison person can help you with your vulnerable populations planning, because they take care of all the people that, for instance, I have a deaf child, so I was always on this program. So they help me make contact with the agencies and within the city that you're in. So they have experience with that. The wing exercise director, this guy has a direct ear to the commander. So anytime you want to do an exercise, a lot of times the med group will get shut out of that whole exercise process, because that's not important. We need to figure out how we're going to handle stuff when the plane crashes, not realizing that there's a medical aspect of that. So the wing exercise director, if you can have him in the room when you're talking about SNS planning or any other type of planning, he's a good person to have, because he can see the magnitude of it. He's not just getting it from the pesky medical people on the base. He's getting it from the local health department with your entourage of IMT, the SF8, the people that you're representing. He gets that. Your public health information officer, equivalent of whatever you have at your location. The Veterans Administration, we talked about that. Luckily, RVA is in Denver, but they are moving to Aurora, so we'll have that special population next. And then if you need volunteers for your MRCs, for your exercises, think about the military retiree groups, the spouses groups, the first sergeants, and the top 3. Those are the different agencies or groups on the base that can help you find those people and those resources. So just recent examples, we just had a regional mass prophylaxis exercise. We have 14 pods, 3 drive-thrus in all of our regions. We opened 2 of those, 1 drive-thru and 1 open walk-through pods. We didn't tie our exercise to the SNS portion because we're just trying to make the things for our but we did involve Buckley in the planning, just so we could talk to them, so they could keep it in the top of their head that we are going to pursue that later. We did ask the WIG director to publish information, so he got us volunteers to come through our pods. Our public health officer and our medical readiness technician serve as evaluators for our pods. And the Guard is having the Guard had a vigilant guard exercise, planes dropping through the air, helicopters and things like that. We did help with the sim cell and the ESFA plan for that. So that's pretty much it.
Thank you, Veronica. So dragging on, I know we're running way behind, but there's a lot of good information here. I don't want to cut it out. So with that, last but not least, we'll turn it over to, there you go, Angela Mora from the City of El Paso.
Good morning again. I speak fast and furiously, so we'll be, you have to listen to me only for about 7 minutes. I'm again Angela Mora with the City of El Paso Department of Public Health. And for those of you who are not familiar with the Texas geography, El Paso is about 700 miles southwest of Dallas. We border with Mexico to the south and New Mexico to the west. And we have a population of about 800 in the city, El Paso County. But combined with the city of Las Cruces, New Mexico, and Ciudad Juarez and El Paso, we have close to 3 million. So, and we all interact and intermarry and everything. everything else. We are also very proudly home to the largest military installation in the country. I think California is the largest. We're the largest in area, but the second largest in population. So I know that I screwed up here a little bit. So I just want to give you a little bit of background about the history of Fort Bliss and the Department of Public Health. So you see the military post was initially established in 1848 with 257 soldiers. The official name came about in 1854. The post closed and reopened twice between 1851 and 1877. The military hospital was established in 1972. That's William Goma General Hospital. The population has grown gradually, and in the last 5 years, it grew tremendously because of the Base Realignment Act. So right now, between active duty and family reservists, we have a military related population of close to 90,000. So that tells you a little bit about, how there's a spillover for medical services in the community. Our Department of Public Health, was established in 1933. We serve a population in the city of El Paso of over 800,000. We have only a budget of $20 million. 260 employees, and of course we provide the 10 essential services of public health. Some of the main collaborations that we have with Fort Bliss are in the lab, epi, disease investigation, and emergency preparedness. The lab provides annual training to the medical center on lab in packing, shipping infectious substances. And in 2011, in collaboration with the state Texas lab, we offer a biothreat agents training for the medical personnel at the William Goma Hospital. We test on a regular basis the potable water for the Fort Bliss water systems. So we test an average of 42 samples per month. In the EPI disease investigation, we receive notifiable conditions reports as required. We conduct STD and HIV investigation and partner notification very closely with each other with both entities to ensure that individuals are treated. In the emergency preparedness area, we are members of the Regional Emergency Management, and we participate in joint exercises including Fort Bliss, hosted by the City of El Paso Office of Emergency Management. We also, the preparedness staff, they provide presentations to military personnel through our Speakers Bureau. So some of the other services that the Health Department provides for the military families and active members, the WIC program provides nutrition program services, STD testing and treatment, HIV counseling and testing and education. And then we're lucky to have a 211 information and referral center within our Health Department. That's a state of Texas program. And we also recently established some walking trails in some of the military populated neighborhoods. Now, this is just, we have 18 WIC centers. These are just 4 of them with military presence. We have one WIC center on base, and that's the one with the all red bar. That's 100% military participation, and we have around 2,500 participants. And then the other 2 with also military family and active members participation as well. This is rent free. We are on base. It was very nice, and we don't pay for rent. This is the waiting area for the WIC center. For the clinic center on base. So in addition to nutrition services and the vouchers that we provide or the benefits we provide, the staff also provides presentations for the women, the pregnant soldier workshop. We participate in pre-deployment health fairs. We also offer presentations to the family readiness program on a regular basis. and we work with families in providing referrals to other services on and off base. The 211 information and referral services, I don't know if you're familiar with it, it's a 24/7 INR center. We have a robust database with health and human services, and we also have a very nice number of services specific for the military, veterans, active duty, and military families. We compile data that we can share with anyone at any time on the needs of the callers. So they range from looking for assistance for food pantry, rental assistance, access to medical services, and so on. So we also offer presentations on pre-deployment events on a regular basis. STD and tuberculosis, we provide STD services to troops and families. A lot of the active members, they seek services, STD screening, HIV in particular, outside of the base due to confidentiality issues. We provide, the STD clinic provides rotations to the medical personnel at Fort Bliss, and we do training, conduct training for the RNs as well in our clinic. We work very closely in the tuberculosis area with a particular physician that refers spouses, military spouses that have been diagnosed with tuberculosis, so we provide treatment for them as well when necessary. Not too many. We don't have too many referrals in this area. The tuberculosis and STD clinic, they meet regularly with the family medicine staff, clinical services provided to the troops. The HIV program staff, they have a designated point of distribution for condoms on base. They do confidential HIV testing away from the base. The disease intervention specialists, they do joint work to facilitate access to care for HIV positive individuals that come from the base. We have a project called M-Factor, and that targets men who have sex with men. And we have been given a site on base to host social events on a regular basis as well. We also receive referrals, provide services, pediatric dental services to families, to their children. And most recently, we created 3 walking trails in some of the most populated, military populated neighborhoods in El Paso. It's Move El Paso. We're in the process of finalizing our community health assessment improvement plan, and we have 3 individuals from the base, 2 physicians and 1 RN that are on the community advisory board. Some of the challenges is that we don't have a main connection on base. Everything is pretty much relationship based. A couple of years ago, they were not referring, Fort Bliss was not referring, reporting the reportable conditions, in STDs in particular. So we had a difficult time connecting with them to show them what the law was and make sure that they conducted their reports to us. And we were lucky enough to hire an individual to work as our CNO, Chief Nursing Officer, that came from Fort Bliss. So she was able to open the door and connect us to people she knew, and we then connected with the staff and showed them what the law was, because they thought that the law did not apply in terms of reporting reportable conditions. So the relationship was established, and it's very good. But in other areas, what we see is that if the individual leaves, then the relationship falls apart, and we have to start over. So there's a systemic problem in terms of us plugging in and helping each other. So we see, we would love to work and collaborate a little more, have joint trainings, meet with them on a regular basis and so on, all to improve the health of our communities. But we don't know now today, I don't know a little bit more on how to go to the top to get this taken care of. So we would like to have greater communication, more collaborations, and do more joint work. I think an interlocal agreement or whatever this document would be would probably be appropriate. But we have the need to really establish ourselves systematically with Probably so we can provide a little more help than what we have up to now. So that's basically my presentation.
Yes, thank you, Angela. So, we are a bit over, and I think what we'll do is, because I know I've kept you in here since the wee hours, is to go ahead and take a 10-minute break now, and I would suggest you find Angela and Pam and Veronica get questions to them directly about their programs. We've learned a lot of interesting things here today about all the ways to engage, whether it's that community health, getting in any way you can, finding out what the base needs, being on site, working a support function, whatever it takes. So do find them at the break. Take 10 minutes. We'll be back at 11, and we'll try to